Hi, and welcome to this edition of Skin and Beyond. I'm Dr. Christine Cabell here at DermDox Skin Solutions. I have with me today Rebecca Geiger, a physician's assistant, and Cassie Manganelli, a wonderful esthetician. And together we're going to talk about some things we could do to shape up for summer. So Rebecca is going to talk about
I'm going to talk about our medical weight loss program, give you guys a little bit of information on how the process works, what medications that we use, and the program that we outline for each patient individually.
And then Cassie will be discussing some other procedures that we have.
I'm going to talk about the Physique, our non-invasive body contouring machine that we use in-house, helps target muscle and debulk fat.
And we will finish up the segment with our radio frequency microneedling device called Virtue, and we'll show you some of the different areas that could be used on, including the face and neck, and abdomen, thighs, upper arms. So thank you for joining us.
Hi everyone, I'm Rebecca Geiger with DermDox Skin Solutions. Today we are going to be talking about the weight loss options and machines that we have here at Skin Solutions. I'm going to start out first with talking about what our weight loss program entails. So we have a couple different options that we tailor to patients. What this program looks like for you is we bring you in for a consult and kind of determine what it is that you're looking for, how much weight you want to lose, what you're looking to improve on. And then from there, we do a full evaluation looking at your medical history, and then we check blood work. We make sure that all of your labs are in line so that there's no contraindications to the medications that we're going to be prescribing you. We have two options for our weight loss medications. One is a liquid that you put underneath your tongue, and then there's also the injections that everybody else is very familiar with. So we kind of tailor that to what it is that you're looking for specifically. Based on what you need and what the labs come back as. So on your initial consultation, after we do the ordering of the labs, we have you step on our scale, which does a full rundown of your composition of your body. That tells us your BMI, it tells us your percentage of body fat, muscle mass, visceral fat, subcutaneous fat, so that way we can monitor that through the process. We have everybody on a 3-month program right now, so basically what we do is we check that at the very beginning. I see you at a 6-week follow-up, and then we do a 3-month follow-up to see the overall picture and compare the measurements from each visit. In conjunction with that, we also work very closely with a dietitian. That dietitian can sit down with you either in person, over the phone, or on a Zoom call, and she will break down everything that it is that you're consuming. She'll look at your composition. She'll tell you, whether you should be eating more carbohydrates, more proteins, less fats, and tailor it to your lifestyle and how you want to eat. Do you want to eat a lot of little meals a day, or do you want to eat 3 big meals and just kind of little snacks? So it's very tailored to each patient, so that you can have this as like your building blocks, and then it's something that's sustainable in the long run. This isn't going to be just a quick fix. You're going to drop a lot of pounds quickly. We want you to do this slowly so that it's manageable over the longer period of time. Then once we do that, after you meet with Taylor, our dietitian, and you go through the program, then we decide, what it is that you're going to do long term for, you to maintain these results. Sorry. In addition to that, after the medical weight loss, if there's things that you want to improve on your body, we have a couple different options here in the office for our machines. So what I'm going to do is I'm going to pass that over to Cassie now, and she's going to talk about the machines that we have here in the office to help maintain those results and get better improvements on that. Thank you.
Hey guys, it's Cassie at DermDox Skin Solutions. I'm the esthetician down here, and today we're talking about Physique. Physique is a non-invasive machine. It targets your fat and helps stimulate muscle. Uses two different modalities for that. So it uses SDM, which is the deep heat component to help melt that fat. And then we also have the EMS, which is the electric muscle stimulation to help really stimulate those muscles and really tighten everything up. We can do a couple different areas with this machine. We can do your arms, we can do your abdomen, inner thighs, outer thighs, and buttocks. Anybody is a good candidate for this machine if you're looking to target areas that you're not getting results from in the gym. So if you have stubborn fat in your belly, stubborn fat in your bottom, stubborn fat in the arms, this will help kind of stimulate that muscle and debulk that fat. Today we have Hannah here. We're going to do a demonstration of the Physique on her so you can see really those muscles contracting and helping her better in the gym. All right, we have Hannah here. We have her all hooked up. So before I have the pad against the back, we have 4 separate applicators. So any of them could be used all at one time. You could use 2, leave 2 off, just depending on the area. Like I said, you can treat multiple areas. You could also treat them at one time. So if you come in, you want to do your belly and your arms, that is perfect. We can do that at the same time. If you wanted to treat upper and lower abdomen, we can do those at the same time. And you're here for about 30 minutes. So I'm going to go ahead and turn this on for Hannah. You ready? Yeah. So we are just stimulating her muscle right now. So do you feel any stimulation yet? Okay. Put it up a little bit. You really want to feel those muscles contracting. Can you feel that? Okay. Can you handle a little bit more? Maybe? So this machine does go up to about 50. We have little Hannah on 10 right now. We don't know if she can handle much more. I do have someone that goes up to 40. This machine is great for someone if you're going to the gym and you have that stubborn area that you just can't get to go away. Physique is perfect for that. It's really going to target those stubborn areas that you're not getting results from in the gym. If you have an injury to your lower leg and you really just want to keep up your tone with your muscle in the belly and just keep up with your workouts, this is perfect for that. Ladies, if you want to strengthen up your booty but you don't want to lose that fat, we could just do muscle stimulation in that area. Doing okay, Miss Hannah? Okay. So like I said, this stays on for about 30 minutes. We just have her on the electric muscle stimulation right now. She is really happy with the amount of fat that she has on her body. She just wants to tone up. As you could see from those before and afters, this machine really works. So it's recommended to do 5 treatments once a week to see full results. You can keep going with those treatments. You don't have to do just 5. You can keep going until you get to your goal weight. But this is a great machine. We love it here. We've seen great results with it so far. And after this, we're going to go over to our Virtue Room and we're going to talk about the Body Right treatment, which combines this machine with some deep microneedling to help tighten up your skin. Thank you guys.
Hi, welcome back. I'm Dr. Christine Cabell and I'm here with physician assistant Rebecca Geiger. And we're going to talk about one other treatment that can be done alone or can be combined with some of the treatments that you heard about earlier in the segment. This is the Virtue Radiofrequency Microneedling Machine. It can be used to do treatments on the face, but today we're going to focus on the treatments for the body since that's what our topic is, weight loss and body contouring. So this machine has a tip, that's a handheld tip, and we put a cartridge right on the end here that's used. It's a single-use cartridge for each patient, so it's very safe, it's very hygienic. That cartridge has multiple little needles that come out of the end of the cartridge, and we apply that right to the skin. And then we, based on what your needs are, adjust the amount of energy that's delivered under the skin through the needles, the amount of time the energy is delivered, and how warm or how intense that energy is. And this machine is used on areas such as the abdomen, the back of the arms. It can be used in the inner thighs and the buttocks. The needles go into the skin and deliver that energy, and that specifically tightens underneath the skin. So it gives you a tighter texture, a smoother texture, and really makes the skin look a lot better, especially after you have weight loss or if you have areas that just have a little bit of laxity. So again, it kind of shrinks underneath the skin with the heat, and then it does resurface the top of the skin. So we definitely see an improvement in like the crepiness of the skin. It could be combined with the other treatments that we had. Rebecca will talk a little bit about that regimen.
So the purpose of this would be you could do this as a standalone treatment, or you could do it in conjunction with the physique, which we had Cassie talk about. So you do your one treatment a week for the 5 weeks with the physique, and if that leaves you with a little bit of laxity or crepiness to the skin, then what you could do is you could schedule this treatment. So a combination of it is called the Body Right treatment. You do 3 treatments of the Deep RF, and you space those 1 month apart. So it's different than doing the physique. Those are weekly treatments. This is a monthly treatment. You do 3 treatments and you space those a month apart. Afterwards, we give you a little bit of gel that you use on your skin and you massage it, because you will notice that you might get like a little bit of bumpiness underneath the skin depending on where we're treating. So we give you that to take home and massage with. You do that twice a day. And then after that, that kind of comes together. So it's a compounded treatment to help with fullness and to help with laxity and tone of the skin.
And I will say we've had great results with both the physique and the Virtue RF treatment for body contouring. Our patients love it. They come back for treatment of additional areas. And you don't have to necessarily be overweight or need to lose weight in order to use the treatment. So we have quite a few patients that are very fit, very in shape, and they have that little area here or there that they would just love to improve on, and it's something that they're maybe not getting that improvement or unable to reach that level with their fitness program and with their nutrition. So we treat that demographic as well. You know, a little bit in the lower stomach. Definitely, we treat a lot of moms that have a little bit of laxity after having their children. As we all age, we all get a little bit of laxity in the upper arm, so that's a perfect area for it as well. And we will be showing some before and afters of like what to expect of the different areas that are treated with this device. I'm going to talk a little bit about our machine, Virtue Radio Frequency Microneedling, for use in the facial area. Because we're talking about body contouring, we're going to talk today about treating sort of excess fat or adipose tissue under the chin and the sides of the jawline, which is a frequent area that we use it. This machine can also be used at a little bit of a lighter setting across the entire face to tighten the collagen and the underneath the skin, smooth the skin, and give a more youthful look to the skin. But today we'll focus on the under the chin and jawline area. This is our patient, Lori, and Lori's interested in treating, just tilt your chin down a little bit, this area right here. So again, this area is full on patients, not only related to weight. It has a lot to do with heredity and just kind of how your skin and your facial features are. And frequently we get patients that want a little reduction in the profile here at the edge of the jawline and under the chin. Especially when they see themselves in pictures, they want to improve the way that looks. So this machine is perfect for that. So it's not actually a laser, so we don't worry about having to protect our eyes or anything like that. It is a machine that delivers radio frequency under the skin to tighten the collagen and help reduce the fat through a series of needles. And what we do before the patient has the treatment done, we put numbing cream on. So we use a topical numbing cream. We use it for approximately 15 to 20 minutes just to take a little the discomfort away. It's not terribly uncomfortable without it, but it definitely helps take any pain away. We wipe that off and prep the area with alcohol, which we've already done those steps. And then we open up our single-use tips. So for each treatment on each patient, we use a single tip that gets disposed after the treatment. So it's very safe. This tip has a series of 36 needles or pins in it. and a little cooling plate goes over the tip as well. I don't know if you could see the little holes there, but that represents where the needles are going to come out of the tip. There's 36 little holes and 36 little needles in there. So each time that I deliver a pulse of energy, the needles come out, go in the skin, and deliver the energy under the skin. And then the machine has to be set for the patient and for the area we're treating and for the results that we want. So we adjust the amount of time that the energy is delivered, how much energy is delivered, and the depth of the needles. So now that I have the tip on, I can set this for our patient. So typically we do 3 passes on the area, we start with the deepest level and then treat a little more superficially with the other 2 passes. So I'm just going to kind of touch the skin gently here and apply the device right on the skin, and you're going to feel a little pinch perhaps. How's that feeling?
Fine.
Okay. So you feel a little heat and a little discomfort as we're going along, but that cooling plate keeps things pretty comfortable for the patient. So we'll continue to do that 2 more times over the skin. Each time I adjust the needle depth a little more superficially. So we're treating deeper and then coming a little more superficial to get a full treatment. Afterwards, the skin will look a little bit red, as you can see. Sometimes you have a tiny bit of pinpoint bleeding, but nothing extreme. And sometimes it looks almost like you have a little bit of hives there as the skin reacts to the heat. So this treatment then would be repeated monthly for 3 times generally to achieve the results we want. But we talk to the patient each time they come in and kind of tailor the treatment and the remaining numbers of treatments depending on how they're responding. And she will not have much downtime. I mean, she might have a little bit of swelling tomorrow, but nothing that's going to stop her from going out and doing everything that she wants to do. So again, this could be used full face, a little bit of a lighter treatment. It can be targeted under the jawline and chin to really debulk and bring that skin much tighter. And then as we talked about earlier with Rebecca, it can be used in different body areas. That is a bit of a different handpiece. Thanks for joining us. I hope you will come back for our next segment where we're going to be talking about the use of Botox, fillers, and some chemical peels, especially one that boosts the effects of the Botox called our Tox Booster Peel.